Bismillahirrahmanirrahim. Assalamu alaikum everyone. This is Farjat Afsal and you are watching my YouTube channel. आज की वीडियो में हम मूवमेंट्स की क्लासिफिकेशन के ऊपर बात करेंगे और देखेंगे कि मूवमेंट्स को हम किस तरह से क्लासिफाई कर सकते हैं। हम फॉलो कर रहे हैं नीना गार्डन की बुक काइनेसियोलॉजी और चैप्टर नंबर 5 है दिस इज़ द क्लासिफिकेशन ऑफ द मूवमेंट। जितनी भी हमारी बॉडी के अंदर मूवमेंट्स हैं या एक्सरसाइजेज हैं उनको हम 2 लार्ज कैटेगरीज में डिवाइड कर सकते हैं। वन इज़ द वॉलंटरी मूवमेंट एंड सेकंड इज़ द इनवॉलंटरी मूवमेंट। वॉलंटरी मूवमेंट्स आर द मूवमेंट्स दैट आर द कॉन्शियस कंट्रोल ऑफ द बॉडी, that are the under the conscious control of the body, and whereas involuntary movements are the automatic movements, reflex movement, and they are not under the conscious control of the body. Active movements and passive movement is another classification. We can classify movements into 2 large categories like active range of motion and passive range of motion. Active range of motions are the movements that are produced by the active contraction of the muscles. When there is we need to bend the elbow, we contract our bicep and there is bending on the elbow and elbow flexion. This is the active contraction of the muscles. Like if you want to bend your elbow, your bicep muscle will become into concentric contraction and it will produce the movement of the elbow and the elbow will bend in flexion. And there are some passive range of motion or passive exercises or passive movement. Passive movements are produced entirely by an external force. Patient's active contraction of the muscle is not needed in these movements. Patient remain inactive. There is no muscle activity on the joint, and these movements are produced by another person, another individual, or gravity, or patient's own another body parts can be used to produce the passive range of motion. And here you can see we can divide the movements into voluntary movement, and there is further classification like free exercises, assisted exercises, assisted and resisted exercises, and then the resisted exercises. So here you can see a graphical presentation to classify the elbow. Like we can divide the movements into two large categories: active movement and the passive movement. Active movements is further classified into 4 categories like free exercises, assisted exercises, resisted exercises, and then resisted exercises. And similarly, passive movements are further classified into relaxed passive and manual mobilization techniques. So this is the classification of the movements or exercises in our body. Thank you very much. Take care.